Welcome back. In the chapter of Health Programs in India, in today's session, we will deal with National Health Mission. The Ministry of Health and Family Welfare is implementing various schemes and programs to provide universal access to quality health care. The Ministry of Health and the Family Welfare, they have started various schemes, implemented various programs so that they can provide a universal access to the quality healthcare in the community. So the rich or the poor, okay, both have to get a universal access to the quality healthcare in the community. The National Health Mission is encompassing its two submissions. So the National Health Mission, it has two submissions. They are National Rural Health Mission and National Urban Health Mission. So we see it has two submissions, rural and urban. You can see National Health Mission. National Health Mission. What are the two submissions? Rural and urban. Rural are the village sites, and urban, it covers the cities, metropolitan cities. What is the aim of this National Health Mission? Aim is to strengthen the health system in rural as well as the urban areas. They need to strengthen the health system strengthening in the rural and urban areas. So they have two submissions, National Rural Health Mission, that is NRHM, and NUHM. The main programmatic components, so now we are moving on to the components of this program. It includes the reproductive, maternal, neonatal, child and adolescents health. They are concerned with reproductive, maternal, neonate, child, adolescents health. Okay, RMNCH plus adolescents health. Okay, reproductive, maternal, neonate, child's health. Along with that, we have adolescents health. It is also dealing with communicable and non-communicable diseases. Okay, they are also considering the control of communicable and non-communicable diseases. The important milestones, the major milestones so far in the National Health Mission includes, in 1992, Child Survival and Safe Motherhood Program. 92, we have Child Survival, CS, Child Survival and Safe Motherhood Program. 97, in 1997, RCH1, Reproductive and Child Health Program, the first phase. In 2005, RCH2. In 2005, again, we have National Rural Health Mission. We see it is in 2005. National Rural Health Mission, National Rural Health Mission, NRHM in 2005. Okay. 2013, we have National Urban Health Mission. Yeah. Moving on, we have in 2013, we have RMNCH plus A strategy, what we studied right now. That is reproductive, maternal, neonate, child health plus adolescents health strategy. In 2013, National Health Mission. In 2014, India Newborn Action Plan. And we have Ayushman Bharat program in 2018. In 2018, Ayushman, okay, Ayushman Bharat program. So under the National Health Mission, they have health interventions or initiatives are taken. Regularly they are designed. Now let us study the various interventions. Before entering into the interventions, let us go through the Janani Suraksha Yojana. The Janani Suraksha Yojana scheme. Now we are starting with interventions. The major interventions or the major initiatives under the National Health Mission. So we see that the Janani Suraksha Yojana scheme. The Janani Suraksha Yojana scheme, wherein there is promotion of institutional deliveries through Janani Suraksha Yojana. We are promoting the institutional delivery. What are all the points in new interventions? First, the Janani Suraksha Yojana, where we are promoting institutional delivery. We have to ask them not to do this home deliveries. In case they persist that they want home delivery only, then it has to be performed by the trained dais. Else, we need to persuade them to perform the institutional deliveries. Capacity building of healthcare providers in basic and comprehensive obstetrics care. Once you encourage the people for institutional deliveries, also we need to have a proper healthcare providers. Capacity building, wherein we are improving the skills, knowledge of the professionals, especially in the obstetric care. Okay, capacity building of the healthcare providers in basic and comprehensive capacity obstetrics care. Operationalization of sub-centers, primary health centers, community health centers, district hospitals for providing 24/7 basic and comprehensive obstetric care services. So we need to bring the sub-centers, PHC, CHC, district hospitals under operation. They have to be in working to provide the comprehensive obstetric care to the care services to the community 24/7. Okay. What are the three initiatives we saw? First, encourage for institutional delivery through the Janani Suraksha Yojana. Second, improve the capacity building of the healthcare professionals. That is, we are building up the skills and the information, their capacity in the obstetric care, the care providers, especially in the obstetric care. Third, operationalization, that is, we are bringing into operation. What are all the things we are bringing into operation? We are bringing the sub-center, then PHC, CHC and district hospitals into operation so that they can provide 24/7 obstetric care, comprehensive obstetric care to the community. Name based. Okay, next, fourth point, we have name based web enabling the tracking of pregnant women to ensure antenatal, intranatal, postnatal care. So we also have this Thai card now, which is it is a name based web. Each woman will get a code with a name wherein we are ensuring the woman is getting her antenatal checkups done, and intranatal care and postnatal care is provided to the women. So we see name based web enabled tracking of pregnant women. In this name based web, we are tracking the pregnant women so that we ensure the antenatal, intranatal and postnatal care. Yeah. So we saw these five points, that is promotion of institutional deliveries through Janani Suraksha Yojana, capacity building, operationalization of sub-centers, PHCs, community health centers, district hospitals. We are providing 24/7 comprehensive obstetric care services. Name-based web-enabled tracking of the pregnant women to ensure antenatal, intranatal and postnatal care. So all these 4 points are perfect. Moving further, mother and child protection card. We are also providing the mother and child protection card to monitor the service delivery for mothers and the children, to monitor the services delivery, the delivery of the services to the mother and the child. Okay. So this mother and child protection card, it is in collaboration with the Ministry of Women and Child Development. The Ministry of the Women and Child Development are in collab and they are providing this mother and child protection card so that they can monitor the service delivery for the mother as well as the children. Moving further, we have antenatal, intranatal and postnatal care. We have antenatal, intranatal, postnatal care, including the provision of iron and folic acid supplements to pregnant and lactating women. Why are we giving this iron and folic acid? So that we can prevent and treat anemia in the pregnant mother as well as the lactating mother. Again, in the 6th point we see antenatal, intranatal, postnatal care to the pregnant as well as the lactating women, and we are providing the iron and folic acid tablets so that we can treat and prevent the anemia. Moving forward, village health and nutrition days. So we have the village health and nutrition days in rural areas. So you can see the village health and nutrition days, especially in the rural areas. It is an outreach activity so that they can provide the maternal and child health services in the rural areas. Health and nutrition education is provided to promote the dietary diversification. We are educating the women regarding the diet, how much she has to include her uptake in the calorie, and what has to be included, what has to be avoided during pregnancy. If she has some bad habits like smoking, alcohol, we need to ask her to quit that, and ask her to take high proteinaceous food, and cut down the junk, and excess calorie intake should also be avoided with the use of junk food. So based on the education, we need to based on the education level, we and also their socio-economic conditions, we need to provide the nutrition education to the mother, and also inclusion of iron and folic acid rich food as well as the food items. We need to give this iron and folic acid supplementation. Rich food items which is promoting the iron absorption has to be educated to the mother. Clear, guys? Let us revise. First thing, what did we see? Institutional delivery. Then the capacity building of the health professional in that particular institution. Just like to remember the point wise. Then now you are encouraging the institutional delivery. So we have to bring into operation the PHC, CHC, sub-centers, and then we have district hospitals so that they provide the comprehensive basic obstetric care to the people. Then we have this name based web enabling the tracking of the women so that she can receive antenatal, postnatal and intranatal care. The mother and child protection card, okay. And then we have about the iron and folic acid supplementation which is given to pregnant women and lactating women, followed by village and nutrition days. It is celebrated in the rural areas wherein we provide the education regarding the nutrition and health to the mother as well as the child. Health and nutrition education is that is we are promoting the dietary habits, iron and folic acid, food items which are absorbing the iron has to be recommended. Moving further to the Janani Suraksha Shishu Suraksha Karyakrama. So we see the Janani Shishu Suraksha Karyakram, SJSSK. What do we have? Janani Shishu. Okay, she is Janani, mother. Okay, Janani is the mother. Shishu is the baby. Suraksha is protection. Okay, Suraksha. Janani Shishu, mother and child. Janani Shishu Suraksha, protection. Karyakram is the program. So we are mother and child protection program if we translate it. So wherein it is entitling all the pregnant women delivery in public health institutions to absolutely free and no expense delivery, including the cesarean section. So in the under the Janani Shishu Suraksha Karyakram, we are entitling the pregnant women's delivery in the public health institutions absolutely free delivery, even the cesarean section free delivery without any expense. The initiative is also stipulating the free drugs, the diagnostics, that is what are all the investigations needed. It could be the blood test and the various investigations which are needed, the blood and the diet, and the transfusion of the blood, the diet, high rich diet, and then the supplementation, like we saw free drugs, iron and folic acid supplementation, and diagnostic, blood and diet, besides the free transport from home to institution. Along with the drugs, diagnostic and blood and also the diet, we are also providing the transportation facility from home to the institution. Now when the mother is having the labor pain, we are providing this free transportation facility from home to the institution. In between facilities in cases of referrals. Now if it's not occurring in the in the district hospital, we want to refer it to a higher medical hospital in the urban area, so we want the referral, the transporting referral system, that is also provided free. And also after the institutional delivery is performed, we are dropping the mother and the child safely back home. Similar entitlements have been put in the place for all the sick infants. Also, the sick infants are provided free drugs, diagnostic, transport, assessing the public health institutions for the treatment. For those who assess the public health institutions for treatment, we are providing similar entitlements also for the sick infants. Clear guides? In the Janani, Shishu, Suraksha Karyakram, you can see here cashless delivery, that is free delivery for both normal and C-section. Then we give the drugs and the diagnostics and the diet. 3 days during the normal delivery we are giving the diet. In cases of cesarean section, free diet is given to the mother, that is for the 7 days. Blood transfusion whenever required. Transport if the mother is in labor, from labor to institution, and once the delivery is done, again it is sent back to home. Okay. Drop back from institution to home after the 48 hours in cases of the institutional delivery, and also transport between facilities in cases of referral. Clear guys? Emphasis on the facility based newborn care at the different levels to reduce the child morbidity and mortality. Again, to reduce the morbidity, death, and as well as the mortality, the diseases of the newborns, we have special newborn care units. So we see the special newborn care units, SNCUs, especially for the care of sick newborn. Clear? We also have newborn stabilization units, NBSUs, and we also have this newborn care corners at the different levels. Under the National Health Mission, we have newborn care units, and then we have newborn care corners, newborn stabilization units, etc. Moving forward, the capacity building of the healthcare providers, again under which we have the trainings which are conducted under the National Health Mission, where we are training the doctors, nurses, auxiliary nurse midwives, so that they can provide the essential newborn care, perform the early diagnosis. We are training them, we are improving their skills, we are improving their education, so that they can perform the early diagnosis, the case management of the common diseases in the children. These trainings are on Navjat Shishu Suraksha Karyakram. We have Navjat Shishu Suraksha Karyakram, and also the integrated management of neonatal and childhood illness is under which we will train these doctors, nurses, and ANMs. We have India Newborn Action Plan. In the milestones we studied India Newborn Action Plan, which was launched in the year 2014. It is launched in the year 2014. What was our aim? Obviously newborn, so we need to reduce the neonatal mortality as well as the stillbirths. So we need to reduce the neonate 0 to 28 days neonates mortality, death of the neonate. It could be because of the low birth weight, congenital malformation, various causes. We need to reduce the mortality rate of the neonate, as well as we need to reduce the occurrence of stillbirth. So we have the newborn action plan, India Newborn Action Plan. Newer interventions to reduce the newborn mortality. We have other interventions as well, so that we reduce the newborn's mortality, which is vitamin K injection, which is given at birth. Along with the vaccination, we also give vitamin K injection at birth. Antenatal corticosteroids for in cases of preterm labor. For those who are having a preterm labor, we are giving corticosteroids. Kangaroo mother care, and also the injection gentamicin is given to the infants in cases of suspected sepsis. If there is sepsis, we are giving the injection gentamicin. You can see here the kangaroo mother care, where skin to skin contact between the mother and the baby is done, so that they can create a bond as well as initiate the lactation as early as possible, and adequate lactation can be performed using this technique. So what are the other interventions we did? Vitamin K, and then providing corticosteroids in cases of preterm birth. Then we have this corticosteroids are given during antenatal period. Okay, corticosteroids for preterm labor. And we have kangaroo mother care. You can see in the picture the kangaroo mother care, followed by we have the injection gentamicin in cases of sepsis. Yeah. Moving further, we have home based newborn care. You can see in the picture here, home based newborn care. Home based newborn care, it is provided through the ASHA workers, and it is initiated to improve the newborn practices at the community level, so that we can perform the early detection and we can refer the sick newborn babies to the institutions. So this ASHA workers will do the home to doorstep delivery of the services, where she will detect the early detection and referring the sick newborns to the institutions. Moving forward to the intensified diarrhea control fortnight. You can see here, intensified diarrhea control fortnight, wherein the main focus is on the provision of the oral rehydration therapy, ORS, and zinc distribution for the management of diarrhea as well as the feeding practices. To manage the diarrhea and feeding practices, we are providing ORS. You could see here ORS, how to prepare the ORS they have taught. And then we are also giving the, you can see here in the picture, the ORS and zinc, so that we can control the diarrhea as well as the feeding abnormalities. Management of the malnutrition. So we also need to manage the malnutrition by the establishment of the nutritional rehabilitation centers. These nutritional rehab centers, they are focusing on the malnutrition. They need to manage the severe or acute malnutrition in the children, followed by the appropriate infant and young child feeding practices. We are providing this infant and young child feeding practices are being promoted. It is in again collaboration with the Ministry of Women and Child Health Development. Moving forward to the universal immunization program, we also have Mission Indradhanush. So the Mission Indradhanush, where we are providing the vaccinations. Okay. So see, bhool na jana, teekakaran zarur karana. So we have this Mission Indradhanush, which is provision of vaccination, where we prevent the vaccine preventable diseases in the children. So we have universal immunization program, where the vaccination is protecting the children against the life-threatening diseases. We prevent TB, diphtheria, pertussis, polio, tetanus, hepatitis B, HIV, measles, Japanese encephalitis. Japanese encephalitis, especially in the endemic districts, like we have Tumkur sides and all, where the Japanese encephalitis is endemic. So we are preventing the children against the life-threatening diseases like DPT, polio, measles, Japanese encephalitis, JE, especially in the endemic districts. Infants are immunized against these 9 vaccine preventable diseases every year, and the government of India is supporting the vaccine program by supplying the vaccines, by supplying the syringes. And we also studied about the cold chain equipment. In epidemiology, we will discuss about the cold chain equipment, where the safe delivery of the vaccines are done to the sites and provision of operational cost. And to carry on the program, we are providing the cost. The government of India is providing the cost for the vaccination, free vaccinations. So universal immunization program, where the vaccination is provided to the children against the 9 life threatening diseases, vaccine preventable diseases, which are those: TB, diphtheria, pertussis, polio, tetanus, hepatitis B, HIV, measles, Japanese encephalitis. Moving forward to the mother and child tracking system. Mother and child tracking system, a name based mother and child tracking system. We have a name based, okay. This mother and child tracking system is again name based, where we put in place a web based registration, where we track all the pregnant women and also the infants, the newborn babies, where we provide the regular and complete service to them, okay. Now, Mission Indradhanush, let us go a little into depth when it was launched and everything. Mission Indradhanush. So, we see the Mission Indradhanush, which was launched in 528 high focus districts, where it is reaching about 2.5 crore children who are unvaccinated or who are partially vaccinated. So those who have not covered during this rounds, during the routine immunization, then they will be having this home visits, where routine immunization will be performed. Those who have not been covered during rounds of routine immunization, then we are including those children and unvaccinated children, partially vaccinated children under this scheme. They will be fully immunized against the life threatening diseases, but they are vaccine preventable diseases. They are life threatening, but the vaccine can prevent those diseases. So life threatening but vaccine preventable diseases, which is including diphtheria, whooping cough, tetanus, polio, TB, measles, Haemophilus influenza type B, HIB, Haemophilus influenza type B, hepatitis B, etc. And also in addition, we have Japanese encephalitis, which is provided only in the endemic areas. Pregnant women will be immunized against tetanus. So we give this tetanus vaccination to the pregnant women during the antenatal care. Why do we give this tetanus injection to the mother? So that we can prevent the neonatal tetanus. Okay. So we know all of this is done. And moving further to the Rashtriya Bal Swasthya Karyakram. Rashtriya Bal Swasthya Karyakram for the health screening, early intervention services. Why do we have this Rashtriya Bal Swasthya Karyakram? So that the health screening is performed and early intervention services are launched, so that we can provide the comprehensive care to all the children in the age group of 0 to 18 years. So we know Bal is the child, okay. 0 to 18 years. Bal Swasthya, that is health. Rashtriya, the whole national child health program, okay, where it's just I'm translating it to you. Rashtriya Bal is a child, okay. Balak, they say, right? The Balak child, Bal. 0 to 18 years in the community. We are providing the early screening, early intervention services, which is nothing but the early treatment is provided to the children who are diagnosed with any of the diseases. The purpose of the service is to improve the quality of life of children through the early detection of birth defects, diseases, deficiencies, developmental delay, including the disability. Under Rashtriya Bal Swasthya Karyakram, the main purpose, it is to improve the quality of life of children. How can we improve the quality of life? By early detection of birth defects, so that the prompt treatment can be provided and we can have a quality life of the child. And we also detect the diseases, developmental delays, deficiencies, disabilities, etc. Under the National Iron Plus Initiative, so we have NIPI, National Iron Plus Initiative. It is through life cycle approach, age and dose specific Iron Plus program, wherein we are supplementing the iron and folic acid tablets to prevent the anemia, prevention of anemia, especially in the vulnerable age groups like under 5 children, children of 6 to 10 years of age, adolescents, pregnant and lactating women, the women in the reproductive age group, along with the treatment of the anemic children and the pregnant mothers at the health facilities. So under National Iron Plus initiative, we are taking into consideration the under 5 children, children of the age 6 to 10 years, adolescents, pregnant and lactating women, women of reproductive age group. So we see pregnant women, lactating women, women of reproductive age group, and along with giving the treatment of anemic children and pregnant mothers. We are treating the anemic children and the pregnant mothers at the health facilities. So this was all about the National Health Mission. Let us lastly study about the targets and what are the achievements. The target in 2012 and 17, by 2012 and 17, okay, by the year 2012 to 17, the target was to reduce the infant mortality rate to 25 per 1000 live birth. By the year 2017, they wanted to reduce the infant mortality rate to 25 per 1000 live birth, but it was reduced to 42 in the year 2012, and it was reduced to 34 in the year 2016. Next, moving forward, the maternal mortality rate. They had a goal to reduce the maternal mortality rate to 1 per 1000 live birth, but it was reduced to 1.30 by the end of 2014 to 2016, approximately reached. Then the total fertility rate should be reduced to 2.1 by the year 2017, but it was reduced to 2.3 in 2015. Reduce the annual incidence and mortality from TB by half. Okay, if the mortality was 100, okay, then they wanted to reduce it to 50. By half they wanted to reduce it, but the tuberculosis incidence is 204 per lakh population, and the mortality at 31 per lakh population in 2017. So the mortality was brought to 31 per lakh population. Next, we have reduced the prevalence of leprosy. Leprosy cases to be less than 1 per 10,000 population, and the incidence, the new cases should be brought to 0 in all the districts, and the rate was reduced to less than 1 per 1000 population. So we have reached the goal. Achievement was less than 1 per 10,000 population. Annual malaria incidence, the new cases of the malaria each year to be reduced to less than 1, and it was reached. It was again less than 1. Less than 1% microfilaria prevalence in all the districts. So out of this, they see that 225 endemic districts, 222 have reported to be less than 1, almost reached. Okay, there were 225 endemic areas, out of which 222 have reported that the Japanese microfilarial infection is brought to less than 1%. Kala Azar elimination by the year 2015, that is less than 1 case per 10,000 population in all the blocks. Okay, so we see in all the blocks they want the cases to be less than 1 per 10,000 population. Out of the 633 blocks, 539 blocks have reported less than 1 per 10,000 population. Okay, so we'll just remember this: infant mortality to be 25 per 1000 live birth, maternal mortality 1 per 1000 live birth, total fertility rate to be 2.1. Next we have next followed by the incidence of mortality from TB to be reduced by half. The leprosy should be less than 1 per 10,000 population. Incidence of the cases to be 0. Malaria incidence less than 1. Less than 1 microfilaria cases. Kala Azar again less than 1 per 10,000 population. So everything less than 1, less than 1, less than 1. TB to be reduced by half. Total fertility 2.1. MMR 1 and IMR 25. So in leprosy, 10k population is considered. In malaria 1k. Okay, malaria 1k. Okay, malaria 1, malaria 1k. And then we have Kala Azar, again 10k population. Fine. So this is about the National Health Mission. I hope everything is clear. If you have any doubts, put it in the comment section. And if you like the video, hit the like button and subscribe.